Kim, you don't need to eat poop. Just use a retinoid consistently.
I'm Dr. Dima Ali. I'm double board certified in cosmetic laser surgery and anti-aging medicine. I also have a skincare line called Cosmetology. I absolutely love empowering people to look and feel their best. So let's get your inner glow and outer radiance to shine bright.
Hello again, beautiful people. On this episode of Skin Fiction, we are going to talk about one of my favorite but slightly confusing topics, retinoids. We'll talk briefly about how they were discovered and why they are suitable for skin. We'll also talk about my personal experience with retinoids and some do's and don'ts, and bust some skin fiction about retinoids. I'll end by reviewing some over-the-counter products and tell you what I think of them. So stay tuned and let's have some fun. Back in the 1960s, a famous, rather infamous dermatologist by the name of Albert Pigment decided to put various substances on the skin to determine their effect. He used all sorts of shit, like detergents, radioactive compounds, even LSD and PCP, HPV, Candida, you name it. He did his experiments on humans in a Pennsylvania prison. There was not much regulation back then. One of the topicals he tested was vitamin A. He observed that vitamin A caused skin to get irritated and to peel. Pigment, along with James Fulton, who I actually had the pleasure of lecturing with at an anti-aging conference before he passed away, came up with topical retinoic acid, and that was marketed by Johnson & Johnson. My first experience with retinoic acid was in high school. Several of us in the 10th had horrible cystic acne, and we treated it with alcohol wipes to try and dry it out, and Clearasil, a topical that contains salicylic acid. 1 year after Christmas break, we went back to school, and a classmate's skin looked like glass. Her red, bumpy pustules were gone. She told us that a dermatologist had put her on something called retinoic acid, but it was by mouth. But it didn't just clear it up. I mean, her skin looked fabulous. No pores, smooth, very ooh-ah. So I got home and insisted that my parents take me to get this fantasy drug. My dad, who has a PhD from Stanford, had to do his research on this, and he pulled a paper from the 1981 Archives of Dermatology. They were things like ichthyosis vulgaris, psoriasis, and all sorts of scary-sounding skin diseases, and he decided that it just hadn't been around long enough to put me on it. So actually, none of the other parents agreed to it either, because they all decided one afternoon that it was clearly too good to be true and that our classmate was at imminent risk of developing some horrible skin disease or a third eye or whatever. To appease me, my mother took me to the drugstore and upgraded me from standard Clearasil to extra strength tinted Clearasil. I tell you this story because my cystic acne and the resulting scars had a huge impact on me. It influenced me wanting to help people that have cystic acne. So, okay, let's talk about retinoids and where they come from. They are derived from vitamin A, which is a fat-soluble vitamin that's essentially for things like our vision, our immune system, and our overall skin health. That's why it's an ingredient seen in your multivitamins and even prenatal vitamins. But there are different classes and types of retinoids, and each one has to go through an enzymatic conversion process to be effective, even topically on the skin. What do I mean by that? Well, you can't just get some eggs and liver, which are high in vitamin A, and grind them up and put them like a mask on your face. It's not going to work. And it's kind of gross. In general, on the lowest end of the spectrum, and I'm going to show you a chart here, we have retinol esters. They are alcohol-based, and they are weak. 3 steps away from converting to retinoic acid. These have very little irritation. They're well tolerated. The next one is retinol, which is a little more irritating, a little less stable, and 2 steps away from converting to retinoic acid. Retinaldehyde is next, which is now only 1 step away from the king, retinoic acid, the superstar. Retinaldehyde is the strongest formula you can get without a prescription. They actually vary in color a bit as well. I make products, so I have raw ingredients here. This is retinoic acid, retinaldehyde, and then a lower yellow, it almost looks white. This is retinol. So how do these work? They are so effective because they actually work at the nuclear level, meaning they bind to specific receptors in the cell nucleus, affecting DNA change. They seep down into the dermis to stimulate fibroblasts and generate collagen and elastin, making them awesome for smoothing out wrinkles, improving skin texture. And in much the same way, retinoids can also disrupt cells, causing a decrease in sebum, this lovely yellow stuff here, which is the nemesis of our acne problems. That's why when you put someone on a regimen for acne, it can sometimes look like a purge is happening. In effect, it's actually happening. It's doing a little roto-rooter on the source of the acne. And vitamin A also doesn't just reduce acne sebum, it actually causes cell turnover. Hence, the dryness that occurs when you first start a retinol regimen. When I put a patient on a prescription retinoid, invariably, even though we stress the side effects that may happen, we'll get a call 2 to 3 days later with a complaint of too much dryness, redness, I'm peeling, this is awful, I think I'm allergic. This happens to everyone. That's not to say that you're not allergic, but 9 times out of 10, you're not, and it's just a normal reaction. So it's a double-edged sword. It's great for your skin if you can just put up with the inevitable side effects for a period of time. Just like many things in life, it's a process. It's a process. It's a process. It sounds better with a British accent. Process. So let's say you have acne as a teenager and you're put on retinoic acid. Then in college or in your 20s, your acne has gone away and you wonder, should I stay on this stuff? Well, after studying and actually seeing the results of retinoids on skin that was treated for acne, namely that skin thickened up, we started prescribing it for wrinkles and crepey skin. So it was sort of a serendipitous discovery that it helps skin look more rejuvenated. So you say, stay on it? Yes, stay on it. Other than vitamin C, retinoids are like liquid gold for your skin. But my acne has cleared up, you say. Well, remember, it's affecting change at the cellular level, the DNA level. It's causing stimulation of new collagen and elastin at the DNA level. Does that turn you on? It turns me on in a very nerdy sort of way. My beautiful people, that will keep your skin young and healthy. We lose about 2% of these structural components of our skin as we age. Using retinoids is a way to stay ahead of the game, slow down the effects of aging on your skin. I'll clarify here. This does not mean you have to put retinoic acid everywhere. Retinol, the less potent version, is over the counter and it's ubiquitous, so in many skincare products, both face and body. Because if you can smooth out your face, why not treat the wrinkled knees and dry elbows? Just slather it on. You should probably bathe in this stuff. Do you get improvement in pigment? Well, in much the same way, it can treat pigment and even early skin cancer. For pigment, it works best when combined with other skin lightening agents. In my lab, I actually add botanicals to my skincare, as well as lighteners like licorice extract, bisbolol, bakuchiol, alpha-arbutin, which is derived from mulberries and bearberries. Let's talk about some problems we encounter. The number one problem with retinoids is compliance. There are ways around it though. You can start really slow and work up to nightly use. You can use a moisturizing sealant like our Galactic Glove or Vaseline or Aquaphor, or diaper rash treatment like Desitin would work as well. Keep in mind that for anti-aging or wrinkles, this is a long-term treatment. You will only reap the benefits as long as you're using it. But if you're looking for that glass skin look without a filter and you don't have the budget for expensive laser treatments, retinoids should be your go-to. Now, you need to use caution around certain areas that are more sensitive than others, like the corners of the nose and the mouth, as well as around the eyes. You don't want to use it on the upper lid because you'll end up with irritation that then needs to be treated with steroids. Secondly, you can't be put on a retinoid if you're pregnant or nursing. Some say you can nurse while on it, but why risk it? Stick to something else like HA or vitamin C or niacinamide. But you absolutely cannot take Accutane or apply retinoids topically while pregnant because there's evidence of teratogenicity, meaning it can cause serious deformities and birth defects in the fetus because it crosses the placental barrier. So this is non-negotiable. Next, how much should you use? The amount to use is the size of a pea. A pea, small pea, not a lima bean, a pea. More is not better and doesn't work faster. Okay. So it's time now to debunk some skin fiction about this class of topicals. You can't mix it with a moisturizer. Scientific studies have actually been done to test the efficacy of retinoic acid and mixing it with a moisturizer, and they show that the effect is just as good, but with fewer side effects of peeling and irritation. Can you mix it with alpha hydroxy acids? I think it's best to alternate nights if you're just starting to see how your skin reacts. For many, using both on the same night might be too much. Also keep in mind that retinoids have a pH of about 5 or 6, and AHAs are acidic at a pH of around 3. So if you're looking to get the most out of each of them, use them separately. I don't want anyone to misunderstand me when I say mix. I mean, put a dab of this in your palm and a dab of that in your palm and mix it together and apply it. I know for a fact that some people decide to get their retinoid prescription, squeeze it out into a big bowl, add their favorite moisturizer to it, mix it up, and slather it all over their body. That is not okay to do. There are some ingredients, namely preservatives and surfactants, that can deactivate retinoic acid, especially when exposed to light. So you're basically throwing money away. So if you want to make some skin potion in a cauldron, brew it at midnight when the ghouls are howling. These products must be used at night. UV and frankly air exposure chemically alters retinoids, making them less active. Remember to always use sunscreen of 30 or higher during the day because it does make your skin susceptible to even more irritation or burning if you don't. The next skin factor, SkinFiction, retinoids thin your skin. This is SkinFiction. If your skin is peeling, that does not mean it's thinning. It's actually doing the opposite. Our skin normally sheds about every 28 days till we're about in our mid-30s. But this process starts to slow down as we age. Using retinoid type products accelerates this process, leading to stimulation in the dermis of cells called fibroblasts, which in turn lead to improved collagen stimulation and reduction in fine lines and wrinkles. Another little known fact about retinoids is that they block the action of an enzyme called collagenase. In medicine, if a term ends with ase, it's an enzyme. Lactase is the enzyme that breaks down lactose. You get the idea. So what does collagenase do? Well, it breaks down the invaluable structure called collagen. Retinoids actually block this enzyme, thereby protecting our collagen, that amazing protein that is the building block of our skin. Use of retinoid products should be seasonal. Skin fact or SkinFiction? This is clearly SkinFiction. They can be used all year round, but you need to use your common sense when it comes to protecting your skin. That means sunscreen, a big hat, an umbrella. Here's a picture of a very good friend of mine. He's a cosmetic dentist. He sent this picture to me and he wanted to assure me that he was using sun protection. So rain, shine, summer, doesn't matter. You gotta wear sunscreen. So I'm going to end today with some examples of over-the-counter retinol products. Nature Kind Intensive Repair Retinol Cream. It's 50 grams. And I think it's $19. Let's talk about why I like this. It has Camellia japonica extract. Camellia japonica possesses lipids with incredible soothing, moisturizing properties to help reduce appearance of dryness and fine lines. It also has green tea and can protect from UV damage, increases blood flow and hydration. It has also niacinamide, we know, which decreases transepidermal water loss and can help with hyperpigmentation. Why I don't like this. While retinol is listed in the first 3 lines of the 10 lines of the ingredients, it makes a claim under uses that it helps tighten skin, and we know that simply is not true. All right, the next one we're going to talk about is Matkes Korean 0.05% Retinol Night Cream for Face. It comes in a 50 ml. I really like this one. I used it all over my knees and elbows, so I ran out. It's $28. The thing I like most about this one is it's made with retinol, not retinol. So it's a step closer to retinoic acid, making it more potent, but with fewer side effects than retinoic acid. So it's essentially 10 times as strong as retinol. Retinol and retinoic acid, they differ by 1 bond and 2 hydrogen atoms. So a seemingly small change in chemical structure can make significant differences. Back to this cream, I think 0.05% is safe strength to start with. You might be able to use that under your eyes. Test it out. We'll see. Tret A anti-aging face cream is great. You can actually see the yellowness in this lotion. It's 0.15%, and it comes in a 15 milliliter and I think it's about $40. I've tried this for several nights and did not have any irritation. Now here's another OTC retinol product at 0.15%. Here's the thing with over-the-counter products. How do we know if the Retinol 0.15% is actually 0.15%? Well, we don't. And we can't really know unless you send it off to a chemist to get tested. That's a problem. Different, on the other hand, we've had lots of studies with. So many of you already know that Differin or adapalene gel was first FDA approved in 1996 for acne, and then it was made over the counter about 10 years later. I find it interesting that it's advertised as gentle skincare. That's just my opinion, because retinoids don't generally fall into what I call gentle. So admittedly, that's more the case with retinoic acid, but adapalene does contain some retinoic acid. It's just in a formulation that was made acceptable for over-the-counter use, and thank God, because that makes it more accessible. So I often get asked if Differin can be used for wrinkles. Yes, it absolutely can. Now, it's a gel, so it's going to be a little bit more on the drying side. Remember to avoid the sensitive areas of your face. Again, go low and slow. I want to mention one cream next. It's called Naily. This cream. It's 4.25% retinol, or it claims to be 4.25% retinol. No yellow tint to it at all. So I really don't have anything good to say about this one. Nothing nice, really. Right off the bat, there are two red flags. One, retinoid cream 4.25%. That's strange. So the starting strength of retinoids is usually in the range of 0.01% to about 2% max. Secondly, collagen creams can moisturize the skin, but they are unlikely to have any anti-aging benefits or stimulate collagen production because the collagen molecules are just too large to penetrate the epidermis. I called the FDA about this one because I was very confused about the 4.25%. The bottom line is with over-the-counter products is that basically anyone can market anything because these products are not regulated as long as they're not called out on it. You're good. Anyway, it's misleading. I wouldn't buy this one. Lastly, I'll mention a couple that are by prescription only. I make one in the office that I can vary the strength on. It has ingredients like azelaic and kojic acid, niacinamide, hydroquinone, but also soothing botanicals like calendula and bearberry extract so that it's strong but very well tolerated. Okay. Finally, there are these two dermatologists at Doctorly, Dr. Maxfield and Dr. Shaw. I mean, look at their skin. It's like wrinkle-free porcelain. I call them McDreamy McDermies. Anyway, they call retinoids the GOAT, which I think is hilarious, because to me, that means Retin-A is a Capricorn. It's hardworking, loyal, loves a challenge, and it's determined to give you great results if you're compliant. Retinoids. If any of you have been on retinoids or have tried any of these, please comment below and let us know what you think. We'd love to hear about your experiences, good or bad. Thank you so much for watching, guys. I hope this was helpful, and I'll see you soon for another episode of Skin Fiction, where we debunk skin and anti-aging myths.